Okay, done.
I welcome you for the webinar being organized by the Europe Direct Information Center, Gozo, on sustainable living post-COVID-19. I would like to thank, first of all, Dr. Elena Grech, Head of the European Commission Representation, Malta, and Professor Charmaine Gauci, who will be the main speakers during today's webinar. Dr. Elena Grech needs no introduction. She started her career as second secretary within the Ministry for Foreign Affairs, moving on to become first secretary in the representation of Malta to the European Union in Brussels, and member of the team responsible for Malta's accession to the European Union between 1997 and 2004. Between 2007 and 2015, she worked in various European Union institutions in Brussels, occupying the positions of legal administrator and then eventually head of unit. As from January 2016, she is the head of the European Commission representation in Malta. Professor Charmaine Gauci has become a household name during the COVID-19 pandemic. She is the Superintendent of Public Health, and her responsibility includes also that of safeguarding and enhancing the health status of the Maltese population. She has previously occupied the position of Director of the Health Promotion and Disease Prevention Directorate for 9 years. Professor Gauci is also an Associate Professor at the University of Malta and an advocate of public health, having served as President of the Malta Association of Public Health Medicine for 4 years. Professor Gauci also acts as a focal point for several bodies within the European Commission and the World Health Organization. But coming again, one of the Rio Declaration on the Environment and Development highlighted how human beings are at the center of concerns for sustainable development. They are entitled to a healthy and productive life in harmony with nature. The COVID-19 pandemic has surely shown the importance of sustainability, as we have now become aware that our society and economy have become too dependent on an unsustainable use of the resources around us. The European Union is working hard on these goals. Suffice it to say that in order to reach the goals of the Paris Agreement on climate change, the European energy system will need to become carbon neutral by the second half of the century. One of the challenges the European Union has is not only the focus on increasing the output of renewable energy sources, but how to store it. This is because the output of solar and wind power depends on the time of the day, the seasons, and the weather. The European Commission estimates, for example, that the EU will need to be able to store 6 times more energy than today to achieve net zero greenhouse emissions by 2050. This is just one of the aspects of sustainable living. Today, we will delve on how to achieve a more healthy and sustainable lifestyle. Dr. Elena Grech's presentation will focus on moving towards a more healthy and sustainable EU food system, while Professor Charmaine Gauci will focus on sustainable living post-COVID-19. I will now leave the floor to our 2 expert speakers on this subject. Just to inform you that though you will not have the opportunity to interact verbally during this session, on the bottom right-hand corner of the screen, there is the comments box. Please feel free to post your questions and comments throughout the sessions. Our speakers will be able to answer your questions and concerns towards the end of the session. The formal Q&A session will be opened after the last intervention. To this end, we hope that you will find this session useful. I now kindly invite our first speaker to begin his presentation.
Professor Gauci, I think you can proceed with your part as we wait for Dr. Grech.
Yeah. Thank you. Thank you for this invitation. It's a pleasure to be able to share our experiences of COVID and also looking forward on how we are continuing to ensure that there is a sustainable system and ensuring that the populations will be living also a healthy lifestyle as well. Throughout the situation of the COVID pandemic, we have seen that we have had scenarios whereby the sudden onset of the pandemic, which first affected the Asian countries, then moved into Europe and affected all the countries within Europe, has actually made big changes within everybody's lives. And in fact, this sudden change has led to people reacting in a different way. We have seen that people have changed in a way that they reacted to the measures which were required in order to control the pandemic. So we have seen people who, especially those people who were in the vulnerable group, who were not attending to work because they needed to be protected. So they actually adapted their lifestyle to that situation as well. We have seen other situations where people were actually working from home, which has its advantages, whereby we managed to have less people within the workplace, so there would be less exposure. But also that led to other advantages, whereby we could see that there were less traffic, so that led also to less pollution as well. But also it had its impact, whereby we saw that some people were feeling isolated from other people, that they were suffering from social isolation, but also feeling the stress of all of this change. There were situations where some people had unemployment. Obviously, we had some situations where certain sectors had to close down. So that had an impact, although the government was on the forefront to be able to sustain these workers through supplementation so they could continue with their economic situation, and also that they could also have enough money to be able to continue with their life as well. The situation for some people, especially frontliners like ourselves, changed completely. It was completely different, whereby the amount of work which this pandemic necessitated which was much more than other people, which required long hours, tedious work, full commitment, and so that affected frontliners in another way as well. And the most important thing throughout this pandemic was the uncertainty. When people have uncertainty in their lives, they react differently. And this caused a lot of stress to people. So we were having situations whereby this was affecting the anxiety within people. So we saw people who usually used to suffer from anxiety and they had relapses of their anxiety, but we saw other people as well who never suffered from anxiety and started having anxiety themselves again. So there were also some situations where we saw that we had some mental health problems as well. So this is how the COVID affected the people as we were going along. There were situations as well where the lifestyles changed as well, whereby we were having, as we said, people who were not going out. We had situations where the places where people usually used to go for doing physical activity, they weren't being used anymore, like gyms, grounds, and playing fields, etc. Because we were protecting the people. So we saw a situation whereby people were obviously doing less physical activity. Throughout, we were encouraging people to also do physical activity, and we also had Port Malta who were on the forefront of this as well, to encourage people even to do activity from their homes as well. However, we have seen situations whereby the physical activity has actually decreased. Another aspect is the nutrition aspect, whereby from the initial reports that we have was that the changes of all this has led to changes in the eating behaviors. So this is a situation whereby we need to see what was the outcome of these changes in the lifestyle behavior of the people. Throughout our communications on the measures to take in order to control COVID, we were alongside also encouraging people to continue to live a healthy lifestyle, because we understood that this is very important. We understood that the impact on the lifestyles would be there. And also, we were also aware that if you have a change in the lifestyle, which is for worse through unhealthy eating, less physical activity, smoking, drinking of alcohol, all this would lead to adverse events in terms of the chronic conditions. And we know that if we have worse chronic conditions, this will also impact on the control of COVID in itself, because we know that COVID will affect people who have chronic conditions even worse than other people. So this is the whole scope that we had this challenge of controlling the pandemic, but at the same time also supporting people to lead a healthy lifestyle. So throughout this pandemic, we saw situations whereby we had challenges in terms of healthy living, but there were also some benefits, whereby we had the benefit that we were seeing people who were looking more at what is really priority in their life, spending more time with their family as well, and also looking at what is most important in life as well. So that will contribute as well to more well-being in the population. Something which we saw as well and has been reported in Malta is that because we had people who weren't going to work and for various reasons, we saw, obviously, it was very clear that there was less traffic on our roads. And this had a direct impact on the pollution levels. We know that the major source of pollution in Malta is from the vehicles. So this had a direct impact, which would be of benefit also to the health of the population. So from what we are seeing, we're seeing that this phase of the pandemic has taught us a lot of lessons, whereby in any strategy that we have in the control of any situation as it comes upon us, we need to continually see the holistic aspect of the control of any situation, whereby when we are focusing on the control of a viral infection, we need also to make sure that all along we are looking at the health of the whole person. But it goes even beyond that. It goes also into looking at the whole situation of the person in terms of even the wider determinants of health. And this is an aspect which is very close to we as public health authorities have been working on, whereby we had already a grant from the European Union to be able to look into the wider determinants of health, the social determinants of health, which look at the daily activities which people live in, whereby we're looking at the basic education level, looking at the housing, the employment, the income of the person, and also the standard of the health services that we are providing. So this is very important that we see that as we are looking at health policies, we need to make sure as well that all the other impacts on the human health is also being targeted as well, so that we make sure that the person has a holistic aspect in health. Looking forward, as we go along throughout the summer, and also as we prepare ourselves for what will be coming, even with the start of influenza as expected in October, we need to make sure that we continue to support our population to be healthy in the holistic aspect. And the best models that work in this area is where you're looking at the settings approach. and also throughout the life course, whereby you look at the person as he grows, where this person mainly is, and you put initiatives within those sectors. So if we have the children and the young babies, we have these who are close to the parents, so targeting the education of the parents and ensuring that they will be giving their children the healthy start that they need. As the children grow older, they spend a lot of time in schools. So that is another target area where we are working on, not only for the control and of the spread of the virus, but also to seeing how we can also continue to improve the health status of the children. We have an important setting, which is the workplace, where we see that the majority of the adults are in, and workplace initiatives are very important to ensure that we have a sustainable, healthy lifestyles, whereby workplaces not only need to control for prevention of spread of COVID through various measures, including hand hygiene, sanitization, social distancing, the use of masks or visor where it is indicated, but also workplaces also have the obligation of supporting their employees. This is important for both. It's important for both the employer and also for the employee, because if the employee is healthy, then he will be able to give more work back to the employer, and having a healthy employee is more productive. So the workplaces have a whole scope whereby they can include healthy initiatives to encourage their employees to be able to live a healthy lifestyle as well. Looking forward as well is that we have a group of our population who are more vulnerable. These are the elderly, who we have protected them throughout this pandemic. And the outcome from this protection of this vulnerable group is that we have seen that we had very few cases which required hospital admissions. And unfortunately, we had 9 deaths, most of them in elderly with comorbid conditions. But if you look at scenarios in other countries who have not taken this protection of the vulnerable as a mainstay of the strategy for control, they had seen much more admissions to hospitals and even much more deaths. So this is a strategy whereby at this phase where we are in a phase whereby the pandemic has been in control, and we're seeing that we have the vulnerable who are going out in the population, they still need to take appropriate measures so that they will have the least risk of acquiring the virus, because we know that the pandemic is still not yet over. But also in terms of sustainable lives and healthy lifestyles, it is important that wherever the elderly are living, there will be the environment which supports their lifestyle. So in old people's homes, having opportunities to do physical activity, opportunities whereby they will be offered food which is healthy food and good for them. So together we can see whereby in each setting that we have, we can continue protecting the people from spread of the virus, but also at the same time throughout this containment phase, making sure that we have initiatives in each setting for the control also of chronic conditions through lifestyle interventions. Lifestyle interventions are very important because we know that they can ensure that persons will be able to live a healthy lifestyle, but also ensuring that as one grows older, the quality of life will remain good. And this is very important also, so that we'll make sure that our population will be healthy, but also making sure that the quality of life of our population is also good as well. So we have learned a lot from this pandemic. We have yet more to learn, but I feel that we need to take the opportunities of what this COVID pandemic has taught us, what we have managed to gain in terms both the prevention, also the way that services were slowly curtailed down to be able to deal with COVID, but then introduced slowly to make sure that all the essential services are there. that we will be able to look at the persons, look at the population as a whole, and ensure that we provide a platform for healthy living, a healthy, sustainable living.
Thank you very much, Professor Charmaine Gauci, for all the good work and for this informative talk. I now invite Dr. Elena Grech to speak with us and explain and share her thoughts as well. Thank you. The Q&A session will open later on, but if you have any questions, please post them in the chat window on the bottom right of the screen. So, Dr. Elena Grech, you can switch on your mic and camera from your AV pod, please. Okay.
Do you hear me now?
Yes, we can hear you. You can proceed. Thank you very much.
Thank you. Good afternoon. And my apologies for being virtually late, but I had a wrong entry in my calendar, and this seminar was scheduled at 4 on my calendar, and I was in another meeting. So I apologize for being late here today. I think it's a very good opportunity, and I congratulate the European Documentation Center and Resource Center of Gozo for organizing this debate, this webinar. It's very topical and also, of course, very much linked to the current agenda of the European Commission, what is happening, what is being pushed forward, and what the priorities are of the European Commission for the time being. It happens to be very much in line with one of the priorities listed by the President, Ursula von der Leyen, in her opening speech of the mandate, when she launched the Green Initiative, meaning that by 2050, Europe would be the first carbon neutral continent in the world. And with this, of course, this goes hand in hand. Also, it touches on a number of sectors of policy, but not just the obvious ones. I mean, normally when one thinks of greening the environment, the world we live in, we think of the seas, we think of the environment, we think of reducing pollution. These are the obvious things that come to mind. But the ways in which it is being proposed to go about doing this includes also the food we put on the table. Hence, there is now the initiative of fork to table, or table to fork. I'm sorry, I'm a bit distracted because of my delay, so I'm missing the terms. Farm to fork, that's the term I'm looking for, which means that getting food to our table should be done in the most environmentally friendly manner and in the cleanest way possible, not just the way that animals are and agriculture goes about doing its work, giving us its produce, but also how then this is transported to us as the final consumers. Now, COVID has been a bit of a spoke in the wheels in this sense, because as everybody knows, I mean, and Malta is an island, so we probably felt it even more over here. Borders closed. So how do you get food? I don't know. I mean, Malta is not a big producer in terms both of agriculture, but also of meat for those who do eat meat. So we don't have enough to satisfy local consumption. We rely on products coming in from abroad. When you have a pandemic, when you have a crisis where borders are closed, how do you ensure that the supply remains constant as in normal times? And this was actually one of the priorities of the European Commission when borders started shutting down, when countries started saying, no, we will not allow flights coming in, we will not allow traffic for mainland countries to cross our borders. For Malta, of course, we all depend on sea routes or air routes for this. But in actual effect, now that we are in a somewhat post or exiting the crux of the pandemic period and borders are starting to be opened, we realized that we did not feel any difference in this regard. Okay, there was a bit of a rush on the supermarkets in the start, at the beginning, when people thought that, okay, now borders will close and there will no longer be the usual supply. But quickly we were proven wrong in our worries and concerns, and supplies continued uninterrupted, just as before, just as normal times. So we all realized that we can continue having food on our table, whatever happens. Now, how can we do that in the cleanest way possible? Because again, as Malta as an island, we are not self-sufficient in terms of production of food, but we can find other ways in which we can grow more of what we need to consume locally, and even as consumers to choose food which is produced closer to home. Now, saying this goes somewhat against the principles of the single market, because in terms of the single market principles, you are not allowed to discriminate where you choose. I mean, not as private consumers I'm talking, because as consumers, of course, we don't have any rules to align ourselves with in terms of where we buy our food from. But when it is a public entity purchasing food, for example, a hospital or a government entity ordering food for its needs, they cannot specify that the producer or whoever the supplier, the contractor will be, should be the closest in terms of distance. Now, saying that would make sense because, of course, it reduces transport costs. And in terms of environmental sustainability, it could also be an argument saying the shorter the distance traveled in bringing over the produce, then the less pollution it causes to come to my table, that I'm generating in getting this food to my table. But so in terms of single market, you can't use distance as a criterion in order to purchase whatever you need. On the other hand, as private consumers, we can have our choices. We can make environmentally friendlier choices, because we see even in other countries, but even in Malta, we're seeing this campaign to buy local. What is the benefit for me in buying local? First of all, it's fresher produce. You're helping the local manufacturer, even though, again, this would go against, in grand terms, in public policy terms, this would not be in support of the single market, because you're not supposed to favor your own producer against any other producer from the rest of the European Union. But of course, the pandemic has given us a new perspective on how we live our lives. It's not just a question of being healthier and safeguarding our whatever we eat. I mean, you know that if you buy local, this food has observed certain health protocols in coming to my table. This food has been produced in a way which is in conformity with local rules. There is less chance of this food having been contaminated in transit whilst it is reaching my table. So, because of course it has traveled a shorter distance. Now, these in real time should not be, should not be concerns that should worry us. Because why should I worry about buying, melons produced locally against those produced in another country, let's say Italy? In the single market, everything, the same rules would apply. But of course, in times, and probably Professor Gauci would agree more on this, the more people come in touch with whatever in the end is coming to me, the more there is a risk of contagion, of spreading of diseases which are not wanted on our plate. I'm seeing a question here from Marlene, which she's asking, healthier food is often associated with a higher price. How can the EU assist in this aspect to also ensure that all the people have access to healthier food? Depends what we mean by healthier food. Do you mean food which has not been treated chemically, or food that has not been sprayed with organic food? why does it have a higher price? It's probably because it's more labor intensive and it needs specific care. The EU would never, the European Commission would not be in support of promoting one kind of food vis-a-vis the other, because that again would go against the principles of the single market. At the end, it's up to the final consumer to decide which food they want to buy and which food they want to consume, and what they are prepared to pay for it. It's a free competition, if you like. The European Union already gives subsidies to farmers. It has the Common Agricultural Policy subsidies. It gives funds through governments, of course. Through the Common Agricultural Policy, farmers and the agricultural sector receive funding to be able to produce specific products rather than others, so as to create a balance in what we are in the end producing, to make it easier for the farmer to produce whatever he is producing, and also to make the prices lower for the final consumer. So there is already that kind of assistance. Now, organic food in Malta, according to what I know, is difficult to certify food as organic given the small size of our territory, because when you say that a product is organically grown, you cannot be within more than a specific distance, I don't know the figures, more than a specific distance from other products which are not organically grown. Now in Malta, with the small rural areas that we have, it's difficult to maintain that distance and to ensure that products have indeed not come in touch, not being contaminated by pesticides or other agents which are used in growing non-organic food. So in Malta, we have to be careful and read more. Unless you grow food in your own garden and you know exactly who your neighbors are and what they are doing, I think it's very difficult to say that something is actually organically grown. Now, to come back to what I was saying and how COVID has given us fresh insight on how we should eat healthy, we saw that, in effect, even border closures have not stopped, as I was saying in the beginning, have not stopped supply. So something must have happened. We must have seen that we are finding alternative ways, alternative foods to put on our table. Are we switching, are we switching food preferences? Are we changing our eating habits? This is all food for thought in reality, excuse the pun, but it's one way to make us think that we have a say, we have a choice, and we can determine what we eat and what the harm on the environment would be in getting the food that we want on the table. Now, when I say, obviously, I mean anybody who's familiar with the agricultural sector would know that certain agricultural practices and animal breeding practices, especially, are rather anti-environmental, if you like, or the amount of pesticides, the amount of pollution that is generated by growing certain foods, by breeding certain animals, is very harmful to the environment. Everybody, I'm sure, knows that eating meat is one of the more environmentally harmful practices of the human being. I mean, the bigger the animal, the more harm is caused to the environment in rearing that animal. So the more meat that is consumed, the more of such animals that are needed in order to satisfy demand. Therefore, it's all about choices that need to be made in view of what we are putting on our plates. In this regard, the European Commission is aiming to educate the farm-to-fork practice and to raise awareness on the whole process of the product that we are getting to our forks from the farm, from the start of its life, if you like, be it an agricultural product or being an animal. How long, what process did it go through to finally get to the status for it to be in my plate? What are the inputs that are involved to get it in the final state it is in my plate? How environmentally friendly or otherwise is it to consume this product or meat or vegetable, whatever it is for me? How can I make better choices for me, health-wise, in a healthy manner, for my own personal health, but also for the health of the environment? One of the positive effects of the COVID pandemic, as we have seen, has been the cleaning up of the air due to lack of human movement, due to lack of circulation, due to lack of people using cars. It has been one of the positive side effects that the environment has literally breathed a sigh of relief. Oceans are cleaner. The waters that we swim in are cleaner. There are more fish, there are more shellfish, there are more birds in the sky. So, and this took just 3 months, 4 months of a different way of life. Think how in an everyday manner, by changing our habits, by changing our ways, and by being more conscious of the effect that we are having on the environment in our daily lives, what big benefits we could bring to the world we live in the end, also for our own benefit itself. I would like to close on this note, in fact, that I think COVID has taught us that humans have, unfortunately, quite a harmful effect on the environment we live in. We knew this, but we probably didn't understand the extent of it until we realized that our shutdown, our lockdown, really gave the opportunity to the environment we live in, to the world we live in, to refresh itself and to become greener, cleaner, and for us all now to come out of our houses and enjoy it better. Anybody who wants to ask any questions, of course, I'm available. Thank you.
Thank you very much, Dr. Elena Grech, for a very informative talk. I will now open the Q&A session, so you can please post your questions, and I will start broadcasting the first question from Mark Harwood. I think this will be answered by Professor Charmaine Gauci. Please switch on your mic, Professor Gauci.
Sorry. Yeah. So here the question is about joint procurement. Yeah, this takes us back a while. So if we look at the experience of the flu pandemic in 2009, this had raised various issues, whereby one of the biggest issue was in the procurement of the vaccine. So at that time, which was a pandemic which was affected by a different kind of flu virus, there was a big chase towards finding a vaccine, similarly to what we have now. And what happened was that each member state was finding its own way to be able to procure the vaccine. The outcome was that none of the member states really benefited much, because we actually did get the vaccine, but even the cost was very high. So that led the European Union to look into ways how we can, as member states, join forces together. And this has led to the joint procurement mechanism, whereby member states will join together to be able to buy whatever is required. In the first instance, for this pandemic, this was used for PPEs, personal protective equipment, whereby joint specification was made and it was agreed on. So that led to the added value that you have the healthcare workers who were actually using the same PPE from different member states, which is based on evidence. So you have equal protection of healthcare workers wherever they were. But also the benefit was that in the very beginning, everyone was buying PPEs from wherever we could find. In fact, even Malta, we stockpiled with PPE as much as we can, because we had no information on how long this situation could take. And we wanted to provide what is best according to evidence and making sure that we have available. So the joint procurement will have added value in terms of having common criteria laid down between member states, possibly having faster access, and also the price will be better and advantageous for the member states. Also, this will support the vaccine procurement as well. So Malta, especially being a small country, whereby in terms of the amount of, for example, vaccines that we need is much, much smaller than other bigger countries, will even benefit us more. So this has been a learning experience and something which we need to work on.
Thank you very much for your answer. I will now post the next question from Ramona Mercia. How is the EU promoting teleworking post-COVID? I think, Elena, you can speak on this. Switch on your mic, please.
It is not really promoting teleworking is not really the competence of the European Union. The competence of the European Union is rather to encourage member states in terms of the Green Deal to find ways in which to reduce pollution across the board. Now, certainly, I mean, if less people commute from their houses to other places, that is one way of reducing pollution and reaching standards of environmental pollution, which every member state has to reach. In Malta, we know that this is a particularly acute problem, but the European Commission has no competence in saying that teleworking has to be one of the ways to promote, to arrive at such goals and to achieve these targets. So unfortunately, as much as we would all probably appreciate it, the European Commission cannot have any say about this.
Thank you very much. Next question from Marvik Refalo. Professor Gauci, please.
Okay, so basically we have these queries about using disposable things in terms of prevention of COVID, especially, for example, if you look at what is being done in restaurants in various areas. There are some things which can be washed, for example, certain cutlery that can be washed. However, you have to make sure that whatever is on the table, it is less clutter as much as possible. So the least things that you have, for example, on a restaurant table, the least risk that there will be. Because if you have, for example, what we used to know about the salt and pepper or the vinegar and the oil present on the table, those are things which are very difficult to be able to clean up in a way to make sure that if there was anybody who was carrying the virus would have exposed these items. So we have made the recommendations to restaurants to use certain disposable, for example, the salt and pepper, etc. For other things, we are seeing that restaurants are innovating. For example, the menu, even if you look back, remember, if any one of us takes back to our situation in restaurants before, you can imagine if you have like a paper-based menu, which has been handled by so many people, obviously that is a source of contamination. But we can also have a situation whereby like the menus, they don't need to be disposable. We're seeing many restaurants who are actually putting the menu on the table and putting a glass over or perspex over the top of the table. So those are innovative ways which industry is adopting to in order to also reduce the waste, which is very important as well in terms of the environment, but also to be economically feasible as well.
Thank you very much.
May I add something on this?
Sure.
What I would like to add to what Professor Gauci has just said is that the European Commission has no ambition to eliminate the use of plastics. Yes, indeed, single-use plastics are the ones that we should be learning to live without. However, in cases where there is no alternative, as it is at the moment. I mean, in most cases, there are no alternatives. The issue becomes one of knowing how to dispose of the plastics that are used, of the material that is being used for single use. So we've seen pictures, unfortunately, and not only in Malta, of many face masks and disposable hand gloves ending up in the ocean, which is definitely not the way to dispose of these single-use items. The important thing is to raise awareness in this case that plastics and masks should be disposed of in the appropriate bins so that they can be recycled, and in this way also contribute to the circular economy, where the material that they are made of can then be reused to produce other things, thus giving them a second life, if you like. Thank you.
Next question. We cannot hear you, Dr. Grech. Switch on your mic, Dr. Grech. Yes.
Yes, I have my mic on now, but I can't hear you very well. No, once again, I mean, the European Union leaves it up to the national governments, unfortunately, at this point, but this is in the process of it being changed. There is no European Commission competence on health matters at the moment. There is no common European health policy. So the European Commission cannot say teachers have to be provided with health masks, because with face masks or shields, because this is not its competence to say it. It's not its competence to decide one way or the other. It is up to the member states, guided by the instructions and information given by the national authorities on the basis of recommendations given by the World Health Organization, to determine what kind of policies to apply. In fact, we've seen, I mean, if one thing was obvious in this pandemic was the different ways in which the 27, 28, if you like, still member states reacted to the crisis. I mean, Sweden didn't close anything at all. Okay, they've seen the consequences. They're still seeing the consequences, but different countries reacted differently. So there is no common policy on how to go about preventing spread of the virus or tackling any current situation. It's up to national governments to do so.
Thank you very much. So, Professor Gauci, would you like to take a question?
Yes, in fact, this is an important issue whereby we already had a problem of obesity across the life course, whereby unfortunately we were seeing that we had a problem in our children, and also a problem of obesity also in the elderly group. We don't have actually statistics at the moment of what these 3 months of COVID has done in terms of the obesity status. We had various views of people saying that some went into a more strict diet and some said that they were eating more. What we know for sure is that we had more people who were cooking at home, which is very important. Just something which we need to build on, because the fact that we had more people at home and they were cooking is something which is beneficial and very much in line with also our strategy, whereby people will be cooking their own meals in terms of being also able to adapt their meals into more healthy meals as well. So the actual impact of the COVID is yet to be seen. However, it's true that Malta has had an obesity problem, and it is an issue of a whole of government approach, a whole of society approach. Something which we emphasize a lot on, that it's not the fault of the person who is obese, but it's the fault of everyone, may I say, because we need to ensure that we educate the general public into what is good and healthy food, the importance of physical activity. This is the knowledge which needs to be continually to be disseminated, but even what's more important is that the population will be enabled through the environment which supports a healthy living, whereby we have enough supply of food which is healthy, which is of good price. And one of the questions raised this issue as well. And also ensuring that our environment also supports physical activity. This is very important. So looking at obesity is not just about education, it's all about the skills that people need to learn, and also having an environment which supports healthy living in every stage of life and in all the settings, as I was mentioning in the beginning of my presentation.
Thank you very much, Professor Grech. Now I invite Daniel Borch to close this Q&A session and eventually close the webinar as well. Switch on your microphone, Daniel, please.
We're now at the end of our webinar. I would like to thank you all for accepting our invitation to join us today. I sincerely hope that this webinar has been fruitful to all those who have participated. I would like to thank Dr. Elena Grech and Professor Charmaine Gauci for their very interesting insights and remarks during the whole discussions. It was a very interesting discussions with many questions raised and also answered. I think that there is another question, Richard, which by Margaret Krefalo.
Yes.
We have the time to get answered, and then I'll close the webinar.
I'll put it up again. Okay. Maybe Professor Gauci can shed some light. Switch on your mic again, please, Professor Gauci. Professor Gauci, we cannot hear you. Please switch on your mic.
The mic. Professor Gauci,
your mic was off.
Was off your mic.
I cannot hear you.
Okay, so sorry. So basically, this question is about the vulnerable people, especially the elderly, who were protected within their homes. And the issue is it unhealthy to stay in the home? We have to understand situations whereby we had a particular situation of COVID whereby we knew that at the time where we had ongoing community transmission, it was very risky to have vulnerable people going out and mixing with other people who may be carrying the virus. Some of them may not even know because some would be asymptomatic. But also very important because knowingly we know that vulnerable people, if they are affected by COVID, they are the ones who will get more complications. So this was essential. So what was being recommended was that the vulnerable people and the elderly, as they were in their own homes, they, or even in old people's homes, they will continue to communicate via other means. And we could see also that in various old people's homes, and they were actually provided even, for example, with tablets to be able to communicate with their relatives. So this is a situation where you have to balance out the risks of having a virus which is going to have a big impact on a vulnerable person versus the situation whereby they were not socializing as much as we usually want them to do. So this is a scenario where we do all the time into balancing the risks that we have. But always, when you are balancing the risks, you see the particular situation and see how you can help also in that situation.
Thank you very much. We have a last question for Dr. Elena Grech. Dr. Elena, please switch on your mic and camera. There you are. Yes.
Yes, I mean, the EU plays a big role in promoting more sustainable lifestyle. And this is exactly what the Green Deal is aiming to do. The Green Deal, the little that we have managed to see of it, because of course it was interrupted by events due to COVID, has been, we have seen that it will touch all aspects of life as we know it now, not just from using alternative means of transport, of how we produce, we manufacture our goods, how we commute to work, of how we go about our daily lives, of what food we buy and what food we choose to consume. This was exactly the topic of today's discussion, how that food is being produced and what we can do to continue to enjoy food which is healthier both for us but also for the environment. We have to keep in mind that what has less of an impact on the environment also goes to the benefit of our global health as a whole. So in the months to come, I'm sure that we will see different kinds of proposals on how the Green Deal will unfold. As representation, as the European Commission representation in Malta, we intend to bring more information to the people, bring even the main speakers from Brussels, the main promoters of this policy, to explain exactly what changes we would need to take into consideration in our daily lives in order to start reaping the benefits of a healthier and more sustainable lifestyle in the years to come. So that indeed it is quite an ambitious target to say that by 2050 the European Union will be the first carbon-free continent, but I don't think that that it is unachievable, because as I said before, we've seen what a difference to the world 3-4 months of our being more careful have resulted in. So if we can adapt our ways of doing things to healthier and more sustainable ones over 30 years, I think we can bring quite a whole lot of new benefit to the world that we live in. And the EU will be behind the promotion of such healthy living, including also through grants and funds, and the Just Transition Fund is precisely one of those funds that are being proposed in this regard to help member states do things differently from the way they are currently doing them themselves. And Malta, for example, has an issue with the cruise liners that berth in our ports, that they have to keep their generators switched on in order to have electricity, whereas if they can be connected to other power supplies on the ground, they produce much less pollution. This is just one example I'm giving, which could be a way of improving our lifestyle over the 30 years to come. So I think it's just a question of awareness. I mean, the more awareness the EU raises about the impact the way we live has on the environment around us, the more we as citizens, responsible citizens, can adapt our ways of life to being more healthy, with probably little changes which we are not even aware we could do so easily.
Thank you very much once again, and I now welcome again Daniel do the ending part of this webinar.
We now come to the end of our webinar. I would like to thank you all for accepting our invitation to join us today. I sincerely hope that this webinar has been fruitful to all those have participated. I would like to thank Dr. Elena Grech and Professor Charmaine Gauci for their very interesting insights and presentations. We know how busy they are, but still they accepted the invitation of the Europe Direct Informations, Gozo, to participate with us today. On a personal note, I would like to especially thanks goes to Professor Charmaine Gauci and all the health professionals out there who have kept us safe during this very difficult period that we have been through. I would like to thank especially Marlene Muscat, who is the manager of the Europe Direct Information Center Gozo, and who has made all of this possible. Thanks for her hard work, especially during this period, in reaching out and informing people about the European Union during the COVID-19 pandemic. I would also like to inform you that a certificate of attendance will also be provided to all those who have registered and attended for this webinar. The Gozo Information Center Gozo, and we as a chamber are glad that we are able to do our part for the community through this service. So be well, keep safe, and stay connected. Thanks very much.